talk about positioning, lifting, and transfers. So this kind of goes along with your lesson on safety, and you need to also make sure that you watch the skill of side-lying positioning, which goes along with this as well. Also, this kind of coincides with your lesson on pressure ulcers. Everything's mixing together as it should. So immobility is a cause of the pressure ulcers and a lot of other problems as well. And there's different reasons why people would become immobile. It could be a surgical procedure. Even during surgery, a person is immobile for a long period of time and has to be repositioned to prevent pressure ulcers from occurring. They may have a cast, which makes it difficult for them to get around, or be in traction, like Buck's traction, where they can't move. If somebody is paralyzed, whether it's from spinal cord injury or if it's a induced coma and they're paralyzed, then they can't move either, and they're going to suffer some of these complications of immobility. And of course, there are diseases that cause immobility. Some of them are progressive and they get worse over time, like MS or ALS. And then some of these people are born with like cerebral palsy, things like that. And we've talked about those. Every body system is affected by immobility. We were not created to just lay around, as much fun as that is. If you've had a day where you've been laying in bed all day and you haven't done anything, when you get up, you kind of feel miserable. You're not meant to be laying around all of the time. For every day that you lay in bed, it takes about 2 days to really recover from that. So you can see here every body system is affected. Your skeletal system, your bones become brittle and weak and more prone to fractures. Your tendons shorten and they can become contracted, which is why, range of motion it becomes so important with somebody who's immobile. And your muscles begin to atrophy, so they kind of waste away. Your nervous system, lack of stimulation is going to cause feelings of depression and anxiety. Which then kind of compounds itself because once the person is depressed and anxious, then they don't want to go out and do anything. So it just gets worse and worse and worse. So we need that stimulation. We need sunlight. We need interaction with other people. We need to be getting out and moving. With the digestive system, peristalsis slows down, so the person may become constipated. Appetite decreases. You're burning less calories. Your integumentary system, we've already gone to a long discussion over pressure ulcers. What can happen with that? Decreased blood flow to your extremities. Your cardiovascular system, when blood's not moving, it becomes stagnant. It starts to clot. So if somebody's been on a long trip or, they've been laying in a hospital bed for a long period of time, one of the most common complications that we see are DVTs, which are deep vein thrombosis. A thrombosis is a blood clot. So we see those clots forming and getting stuck in small blood vessels. And then your lungs, when you're up and moving around throughout the day, you don't realize it, but you're taking deep breaths into the base of your lungs. When you're laying in bed and you're not moving around very much, you're not doing that. So one of the important things we need to be telling our residents and our patients is to take deep breaths and cough. Get stuff moving around because all that mucus just kind of sits there. It goes down into the base of our lungs. The base of our lungs fills up with fluid, and then that person will develop pneumonia. So we need to be taking deep breaths and coughing periodically. In the hospital, you might see something called an incentive spirometer that kind of sits on the side table where the person sucks into, and it forces them to take a deep breath and get air into the base of their lungs. So you need to be encouraging them to use that if you're working in a hospital. And then your kidneys, everything kind of slows down, which can lead to incontinence and urinary tract infections because they're not getting up to use the bathroom as much. Here are some of the positions. You're just going to simply have to memorize these. You might want to use flashcards if you're having trouble. So supine is flat on your back. Fowlers is sitting up. So there's semi-Fowlers, which is like a 45-degree angle, and then high Fowlers is a 90-degree angle. Lateral is side-lying. At the bottom there, you'll see what we call left lateral. which is Sims position, but it's also with the knee tucked up real high. It's always on the left side. And that's the position that we use if we need to do something like give somebody an enema or if they're getting a colonoscopy done, because it exposes the most amount of colon. So you might see that on a test question somewhere one day. So prone is on your stomach, and of course we all know what sitting is. The only position that's not in this picture is Trendelenburg, and that is called the shock position, and that is with the head down and the legs up. So you're just kind of like at an angle, but with your head facing downward. It's called Trendelenburg. So we talked about turning and repositioning with pressure ulcers. But if somebody is immobile and they're not able to move themselves, or you walk by and you notice they've been in the same position for a long period of time, you need to initiate this yourself or talk to your nurse about it. We need to turn that person at least every 2 hours, no less than that. So some places have something like this where there'll be a clock on the door or on the wall, and it'll say back, right, left, or window, ceiling, door, so that you know if that person's been turned or not. So if I walk in and it's 1 o'clock, they should be on their back. If I walk in at 1 o'clock and they're still on their left side, then I know that they haven't been turned. So it's an easy way for a nurse to see if this stuff is being done, because ultimately everything falls back on the nurse. So, important things to realize. People need to be up and moving, and if they are not able to do that, then it's our responsibility to prevent these complications from occurring.